Can someone please tag a pharmacist for me? Preferably one that works in retail pharmacy, not the hospital setting. So, as you guys saw on my last video, I prescribe a lot of mounjaro off-label for weight loss. Yes, it is indicated for type 2 diabetes, but it is highly effective at aiding in weight and appetite suppression. So, here's my beef with the pharmacies. I am sending prescriptions to the pharmacy, and the patients go to the pharmacy to pick up their medicine. They're super excited to start their journey. They get to the counter, the pharmacy tech says, "Hi, Mrs. Smith, are you diabetic? We have this prescription ready for you." If they say yes, then they will fill the prescription. If the patient says no, the pharmacy then decides to not fill the medication. So my question is to the pharmacist, when are you going to ask the patient about their other diagnoses every time they go to the pharmacy? When you fill their losartan, are you asking about their most recent blood pressure reading? When they fill their hyperlipidemia medication, are you asking what their most recent LDL is? I don't think so. So my toes are very stepped on, and not to say I love my pharmacist guys. You guys keep us in check. You keep us from making errors. You provide a nice safety net for us in case we're writing medications that have a drug-drug interaction. You guys are definitely the guru on medications. And I appreciate the help, and I'm no shame against any pharmacists, but I am frustrated with the fact that the pharmacies are deciding whether or not a patient gets a medication, which is way out of line. It's that medication decision should be between a provider, a patient, and the four walls in my clinic. And yes, it is my job to educate the patient on the medication, the use of off-label, the use of side effects, all these things. It is not the pharmacist's place to decide whether a patient gets a medication. If you're watching this and you know a pharmacist that works in retail, please tag them in my video. I'd love to see why you guys are doing this. Is it political? Is it financial? Because it's not what's best in the patients or what they need. So it kind of blows my mind, like what's the motivation behind not filling prescriptions for patients for off-label use? You know, we use seizure medications to manage migraines. We use antidepressants to treat anxiety. We use Wellbutrin to help people stop smoking. I mean, there's tons of off-label use. So it doesn't make sense to me that retail pharmacy is telling us we can't do it just because it's a new medicine and figure it out to go to your doctor. Because what I'm going to do is just send it to another pharmacy, to be honest. So stitch me, comment. If you are a pharmacist, I am dying to know the answer. No hate, guys, only love.